am Dr. Vijayakumar Narayanan. I did my basic medical graduation from Kerala, South India. Okay, coming about breast cancer as such. What is breast cancer? Usually, when we ask what is breast cancer, if you identify a lump in your breast, we suggest the women to do breast self-examination, especially when they take a shower and all, to examine their breast periodically. Just palpate breast in different quadrants with the palm. And if you identify any mass in the breast, any lump in the breast, don't hesitate. Not all the lumps can be cancerous. Most of them may be simple hormone-related things called fibroadenomas and all. But it can be malignant. If it is malignant, then it should be treated. So just by observing a lump, you cannot proclaim yourself that, oh, I got cancer. It's not like that. So once you observe a lump in your breast, you need to seek a proper medical attention. What we do initially when a lady is coming to me with breast lump, I will also conduct an examination. Then I will confirm that lump. Some characteristics, we will just examine the patient generally, clinical examination. We will see whether the tumor, whether it has got characteristics of a tumor. What's the main characteristic of a tumor or a malignant disease? There is possibility of it to spread to the nearby organs. In breast cancer, it is armpit nodes. We examine the patient for the lump as well as the armpit, and then we will conduct a general body examination to see whether there is any enlargement of the liver or some other organs and all, or the neck nodes or anything. So if we have a suspicion of breast cancer in a lady, then what we are going to do now is we will subject that patient to some imaging. We have ultrasound imaging of the breast, we have mammographic imaging of the breast, then we locate the lump precisely, and then we will put a needle into that. We call that core needle biopsy. That's a very important thing. The diagnosis of the cancer is always coming from a pathologist's lab, not from a clinician's or a physician's office. Even if I have 20 years or more experience in cancer, I cannot diagnose cancer without a proper histological confirmation. We call it as tissue diagnosis. So we will put a needle, we will remove a small tissue from that lump, and we will subject it to microscopic evaluation, and the pathologist will tell you that it is a malignant disease. So once a malignant disease is confirmed on a breast patient, then what is next? Never jump into a treatment. That is my advice to all my patients. In cancer treatment, you are not supposed to go to a surgeon's table or a chemotherapy or a radiotherapy immediately. That is not the way. You need to sit, you process it, you make a plan how to deal with it. So first thing what you need to do is, you have to have a proper staging workup. You need to stage the disease because the treatment depends on the stage of the disease. Whether it is stage 1, it has got a treatment. Stage 2, it has a, these are all recommended guidelines for managing different stages of the treatment. So mainly by staging workup, what I am telling you is to see whether this breast cancer is localized only on the breast or whether it has gone to other parts of the body. If the tumor has gone from the breast onto the liver, it's a stage 4 disease. Gone on to the lung, it is a stage 4 disease. Any distant areas from the breast, we have to call it a stage 4 disease. If it is a stage 4 disease, what's the purpose of removing the breast? There is no need for that, isn't it? Then the treatment is entirely different. We just do palliative treatment. So first thing is proper diagnosis using a needle biopsy, then staging workup, then the plan the treatment. Planning of the treatment, sometimes we offer neoadjuvant chemotherapy. That is a chemotherapy that is pre-operatively given to the patient. See, in yester years, when I was in our oncology programs and all, most of the breast cancer patients were ending up with mastectomy. Mastectomy means anything with a suffix ectectomy means removal. You have heard of appendicectomy, cholecystectomy, mastectomy. So removal of the breast. Nowadays it is not like that. If there is any possibility to preserve the breast, we always suggest the patient or the lady to preserve her breast. Thank you for joining with me for this discussion on cancer, especially the breast cancer and prostate cancer. I'm an oncologist, and you can book my services through ponea.com, and ponea.com is a wonderful service provider for different specialties of medicine, and you can access my oncology services through ponea.com. Thank you very much.